Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Is it dangerous if my shoulder clicks or pops, ankle pops, and how to know and self-treatment to fix? We're going to cover all those things. Not my shoulder, your shoulder.
That's right. And we're going to show you why it does it and some good solutions to correct it. But before we go on,
if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also go to bobandbrad.com and go to the giveaway section because we're always giving something away. What it is today, we don't know.
It's a future video,
It's a future video. So check it out. Let us know. Put it in the comments what we're giving away. You can also go to Facebook and it'll be pinned to the top of the page, the contest. Go to Twitter, Instagram, TikTok if you want a 60-second version of our program where we don't ramble. And also, Brad, what do we have?
We have podcasts out now with some outstanding interviews and great subjects so you can even hear us without looking at us.
Win-win.
All right. Should we carry on, Bob?
Yes.
Shoulder clicking, this is not uncommon. Usually especially when we get a little older, but it happens oftentimes with some injuries. The injury heals and then afterwards, oh, my shoulder clicks and pops and it didn't before. So is it a concern or not? That's what we're going to do. We're going to talk, but we're going to answer that but. This is a but question. Forget it. Anyways, we want to talk about why. Why does it click? Why does it pop? We're going to go through 4 different common reasons. Number 1 is common arthritis.
Right.
Arthritis in the joint itself. If we look here, we've got a really smooth surface.
And it connects with a smooth surface.
Right. And, with a healthy joint, as we age or an injury, we may have some problems. We call them lesions or where it's not smooth anymore. And as the joint slides over the area that's not smooth, it
can be kind of flaking.
Yeah, they can call that crepitus.
Yeah.
It's grinding, kind of Rice Krispies makes that noise. That can be one problem. The next one is the labrum, which is like a cartilaginous material, tissue, not material.
It's a round circle, basically. Pull towards you into external rotation, Brad.
Yeah, we're going to get out of here. We've got to get the capsule out of the way. Right here where the blue tip of there, thank you, Bob, right here. And that keeps the joint, helps keep the joint stable.
Yeah, holds it in place.
Right. And if that can be tore, it can have a piece ripped out of it, so to speak. If there's a problem with it, that can be a problem with
not uncommon over time for that to wear out.
Right.
And just like any other thing in your body.
I have a friend right now, Chris, actually, he can do bench press without a click or a clunk, but when he does push-ups, his shoulder clunks all the time. So he doesn't do so many push-ups anymore.
Right. You gotta learn.
That's right. Sometimes tendon snapping.
Yep.
Because we've got the biceps tendon here. We've got the deltoids.
Supraspinatus tendon.
Yep. All the rotator cuff. A lot of tendons in the shoulder. And as they slide over the bone, they can click and clack and cause problems that way. And then also if you have a rotator cuff complex, there's 4 muscles there, and one of them or more than one are either injured or weak, so the mechanics are thrown off.
The 4 work together to help hold that bone in place.
Exactly.
I'm going to throw one more in, Brad.
Okay.
If you have poor posture of the shoulder,
and
the shoulder has moved forward, the humerus here has moved forward in there, it can cause clicking and grinding, and it can cause arthritis.
Exactly. As a matter of fact, that's the first thing we're going to address is posture.
Yes.
Regardless, you need to work on that. And if you got the shoulders forward, one way you can check it, if you're by yourself and you look in the mirror, you can check it out. There's a one if your thumbs are pointed inwards. There's a good chance that your shoulders
should be pointed straight forward if you're in good position. But if you're in poor position, they rotate in.
Right. Oh, Sam's in the way. We're going to go over to the wall. Another quick check for good shoulder posture is you just need a flat wall. Stand like this. And if there's a big gap between your shoulder and the wall, they're more than likely rounded forward. Bring them back like this. and feel the difference.
Right.
You can feel the wall there. And now I'm going to show you some exercises because we want to actually strengthen it. You can do this. You can do the W exercise where you bring your arms out. See if you can touch them to the wall. Make sure your head's not forward. Do that 10 times in a row. 5 times a day would probably be a good way to address that.
Throughout the day.
If you want to work some extra strengthening, you can use some bands, which we like to use so you get more strength, more promotion of that good posture. You just hook it around the doorknob. We use a wall anchor because it works really well. And you pull back and squeeze those shoulder blades
a little
together.
bit, Brad. Turn.
Oh, I'm sorry.
You can see then he's squeezing the shoulder blades together. It's just I mean, for this reason alone, you should have some bands like this just throughout the day. Tighten them up, and it reminds you where it should be. Plus, it strengthens the muscles that are going to help it stay there.
That's right. And do at least 15 repetitions of these.
You can do more. That's kind of a postural muscle as far as endurance.
Right.
So you can rip off more if you like.
Sure, you bet. All right. The next one is we want to look at range of motion. So we're going to look at our posture. We're going to work on that. And then look at the range of motion. Say one shoulder goes up to here and then it goes down. So like Bob, you can almost touch the ceiling there.
I can touch the ceiling.
Yeah. And if the other shoulder, say he cannot touch the ceiling because it's lacking, it only goes up this high versus this high. We need to work
on some flexion.
Yeah. We need to work on getting that stretched out. And of course, we're going to do all these exercises with good posture. So show them the first one, Bob.
Sure. Let's say you're missing flexion. So an easy way to do this is just, I'm going to go this way, Brad.
Sure.
Yep. So you can see. You can actually just palm facing me, palm out.
Yep.
And I'm going to work into flexion like this.
Right. So this would be the good arm, and the one that needs to be stretched is here. And he's going to, the force of the stick is going to help that stretch that.
Now you can also, let's say this is the involved arm now,
Sure.
and I'm lacking extension. So I can actually just push it back now. And this is very common. You'll find it in a lot of people that this is the one that they're having trouble with. I think the arm doesn't go back very far, or they don't go very far up their back.
Right.
So they can work on extension like this. You can also, this is where the booyah stick is nice. I got palm out, I got palm in, and I can just work on bringing it up like this and working on an internal rotation.
This is one of those real functional, exercises that you can get your wallet in and out of your pocket, put your belt in,
scratch your back,
Exactly. The next one I do want to mention, Bob, is which one do I want to mention?
You want to do the
I
was going to say the Statue of Liberty.
Statue of Liberty. If this range, and you really need this range for work or for whatever, you can do this seated. You need a stick 4 or 5 feet long like this, and you're going to reach up here, and it needs to be able to stick on the floor.
Right.
If it's carpeted, that's fine. Otherwise, you'll need a rubber tip down there or something of that nature.
What's nice about this is you're actually getting some traction on the shoulder too. So you're getting you're stretching that capsule out. It's just, this is so much more effective than just going like this.
Yeah,
I mean, it's
a lot easier, actually.
It's a lot easier. Yeah. We have people with arthritis who do this. They love it.
Yes.
But don't let your hands slide down.
Yeah, don't let that happen.
Yeah.
I made that mistake with one patient. He was doing that, and he said, it's not getting any better.
Yeah.
I said, I did a bad job of showing him. And actually, if you get up to the top, and it's easier too.
And I actually do it on a chair because...
you can...
Yeah, there you go. If you're really tall like I am.
Yeah. Oh, yeah.
Like that. So,
so
awesome.
Get the range of motion so it's equal on both sides, so it's functional, so you can get up there. And then strengthening can be a problem as well, oftentimes with clicking.
And that's the rotator cuff. That's where we want that rotator cuff working really well to hold that ball into the socket.
So I'm just going to show one simple way to test this. So Bob's going to make fists. He's going to have elbows in by his sides, and the fists are going to be straight out, not in here and not out here, but straight, like you're running.
Rocket sock'em robot.
And now he's going to stay still like a statue, and I'm going to push inwards.
And I'm going to resist.
Right, so he's pushing. Yeah, go ahead. Let both of them go. So I'm going to push this way, but he's going to hold. Now, oftentimes, that'll happen.
Right.
And it's a very common, it's probably the most common weakness, wouldn't you say, Bob, in the rotator cuff?
Yeah.
So... Now this one, it works really well And I'd say most therapists will give their patient
Right.
a TheraBand, or a stretch strap, and they're going to strengthen doing this.
External rotation, keeping the elbow into the side.
Yep,
Sometimes we'll even put a towel there to help keep you from cheating.
Yeah, we don't want this.
Yeah,
we don't want
flying
this.
wing.
This is one that I oftentimes have to correct my.
Just keeping a right angle at the elbow.
Yeah, so I'm doing that, not this.
Yeah.
But we need to stand sideways. And even if I always say, do the weak one, and then you might as well do the strong one, because the strong one can use some maintenance, but it also gives you an indication. If you only can do 5 or 6 and it gets kind of tired, the other side you need 10. You want to work with
how far you have to go.
You want to work with it until this side feels as strong as this side with that motion. Wow, Bob.
I think we did it finally.
Yeah, I think that covers the most of it. Again, posture, range of motion, real critical, and then hit some strengthening exercises just with that.
And remember, let's help everybody out there. Let's help other people.
That's right.
Be kind.
But what about our other conundrum, Bob? This is something we've been working on for years.
We can fix just about anything
except for
a broken heart.
Yeah. How'd you like that segue?
Yeah, that's good. Finally.
Take care and enjoy.